Video today, we're going to talk about topical anesthetic patches. So when you go to the pharmacy or drugstore, one of the things that you're going to see is a whole host of products that are present in an aisle, from different bottles to boxes to a whole host of different options to be able to treat pain. And one of the things that's most confusing is, what do you pick? So in this video, we're going to talk about topical pain patches. Why are we talking about patches as opposed to creams? Because creams can sometimes be very messy. They can be difficult to apply, and they can be difficult to be able to utilize with an active lifestyle. So we're going to look for patches that really allow for you to be able to place it, set it, forget it, and get back to doing what it is that you want to do. So the first type or class of patch is going to be something that's called a counterirritant. So counterirritant is a patch that provides a certain substance that distracts from the pain. In essence, it provides a sensation that's either cool or warm. These are going to be things like Bengay or Tiger Balm that really help the nerves hone in on a different sensation than just the pain alone. When dealing with a counterirritant type medication, frequently it has a strong odor that's associated with it, and that's because of a certain substance that's contained within it. Depending on your degree of sensitivity to that odor, it could be pleasant or it could be off-putting. Those are going to be things like menthol, camphor, wintergreen. All of those types of products are going to be contained within a counterirritant type product. So again, counterirritant type products are going to be things like Bengay. The second class is something that's called a salicylate. So salicylate basically comes from the aspect of a non-steroidal or an aspirin type product. The upside to these type of products is they typically don't have an odor that's associated with them. However, they can have other issues where they can be problematic for individuals that have either an aspirin or NSAID sensitivity, or are on blood thinners like Coumadin, warfarin, along those lines, and then have some issues. Typically with a topical application, the degree of uptake is not great enough to cause some of those interactions. However, it is a possibility that those things could occur. The third class is capsaicin products. So capsaicin are isolated from peppers that have a burning sensation. So the burning sensation is directly related to capsaicin, which influences an element in the nervous system called substance P. When substance P is altered, it can decrease pain. The upside to this is that it has a direct effect on pain, unlike some of the other topical applications, which really are more distractions or temporizing. This can actually be able to treat pain to an extent. The downside is the burning sensation that's associated with it. Frequently, that burning sensation is very challenging for many people. Examples of a capsaicin product would be something like just generic capsaicin patch, or the aspect of something like Zostrix. The fourth and final patch would be something like a local anesthetic, which typically is going to contain lidocaine. So many people have heard of lidocaine. They know that it's a numbing agent. It provides a degree of pain relief. The upside is that it typically will stop that pain without any odor that's associated with it. However, the downside is in certain individuals, lidocaine can precipitate irregular heartbeats, among other issues. So to summarize, for topical patches, there are 4 different classes that exist that really can be able to provide some degree of relief. And this is in reference to non-natural substances. This is over-the-counter medications that are not opioids, but are pain relievers. So the first class is going to be those counterirritants that provide a sensation that the body then focuses on as opposed to the original pain. The second is a salicylate class, which is really an anti-inflammatory type medication. So instead of you taking an aspirin or taking an ibuprofen, it's provided in a topical element that provides anti-inflammatory properties. The third is that capsaicin class that directs and goes after elements of substance P that really is involved with the processing of pain. And the fourth and final class is going to be local anesthetics like lidocaine that can be able to stop pain. So, what product is going to be the best product for you? Well, first of all, that's going to be something you're going to need to try with the caveat of understanding not every product is going to work for every person. Preferences are going to be impactful. So if you can't tolerate strong smells, or you can't tolerate aspirin, or you're using a blood thinner, or just the thought of adding heat to whatever ails you just really is not a fit, you'll have to adjust accordingly. If we're given a ranking of actual treatment, probably the patches that we would use in order would be something like a capsaicin type product initially, the elements of a salicylate secondary, third would be a local anesthetic, and finally the counter irritants would be the final class. However, the fact of the matter is many of these products have a mixture of different components of each of those different classes. So you'll need to look to see, do they contain some of those substances that we mentioned earlier? And then you can be able to tease out, is this going to be a fit for you versus not? If it has capsaicin and possibly local anesthetic, maybe that's going to be a good fit for you as a perhaps something that has an odor that just really isn't agreeable with you. The other thing that really needs to be hammered home is these are not the only products that exist. There are also natural substances that can be used for pain relief. But if you want to know about that, then you need to check out one of our other videos. Question of the day. So, if you were going to use a patch in the future for a sprain or other pain issue that you might have, what would you pick? And what have you picked? What worked best for you? Let us know in the comments below. Thank you so much and have a great day.